So, hello everyone. Welcome to Behind the Research, the newest segment of PT Meal Podcast in partnership with the Philippine Journal of Physical Therapy, or PHJPT. So, in this segment, we will take a deep dive into the research and talk to the authors of select articles published in the PHJPT. So, in this first episode, we will discuss the research entitled Perception of Filipino Physicians on the Roles and Scope of Practice of Physical Therapy in the Philippines, a multi-method quantitative study. So I'm pleased to have back in the show the principal investigator and advisor for the research, Archelle Jane Callejo-Tiuseco. She's a faculty member of the College of Rehabilitation Sciences in UST. She's also vice chair of the Neuro SIG of the Philippine Physical Therapy Association. So with her are her co-authors or co-investigators, Mae Rueda, fourth year student from the College of Rehabilitation Sciences, UST, and Kyla Mari Carbonell, an alumna of the College of Rehabilitation Sciences in UST. So also joining the conversation is Dr. John Hubert Pua, an orthopedic surgeon and an assistant professor in the Faculty of Medicine and Surgery of the University of Santo Tomas, to provide us with a physician's perspective to the research. So welcome everyone. I'm thrilled for our discussion today. While looking at the research, I was really interested because uh, looking at the title, Perception of Filipino Physicians and Roles on the Roles of Scope of Practice of PT, because I remember back when I was practicing in the Philippines, sometimes you wonder, what physicians think about our profession or practice, because sometimes we receive referrals that are like, you would think that why are these patients referred late, or why just now, or why wasn't a patient referred to us at all. So sometimes we wonder, what do they know about our profession and what do they know about what we do as a healthcare profession. So I guess this article can somehow answer some of those concerns. So, but before we really dive into that, for the authors, could you give us a brief overview of the study, a short background, without giving into too much detail?
All right. Okay. Yeah. Good morning, everyone, and good day to all the listeners of this podcast. And we are very much happy and privileged to be sharing our study. Okay. To begin, this is a faculty-led research study, and with us are students from the USTCRS and alumnus. And actually, the inspiration was same thoughts, Sir Johan. What could be the physician's perception about physical therapists? And although there are actually referrals from to us as physical therapists, but then there comes the question that are the doctors really aware of the specifics of the practice that we provide? Because again, it's like the big question na bakit meron pa ring tawag dito notion na physical therapist just provides exercise. But I think of course we provide beyond that. So parang naging ganun yung inspiration ng study. So why not we begin with the doctors who are actually referring the patients for rehabilitation. It's not just rehabilitation medicine. So there are a lot of specialization that can actually talk to us and refer patients for physical therapy care. And then of course the idea of the study is somehow to help Philippine Physical Therapy Association to give them an information of what is the current awareness of the health professionals in terms of the physical therapy practice. Yan kasi 'di ba we are on this step of we're actually making an initiative to revise the current law. Yun po. So actually that's the inspiration of the study.
Thank you, Ma'am Archelle. So, Kayla, could you summarize to us a brief summary of what the study is all about?
Mhm.
So primarily po, since our profession here in the country, it's mostly dependent since yung sa law po natin, yung RA 5680, it our practice still relies on the referral system na before we get to see our patients, kailangan may prescription muna from the doctor. So, important dun yung perception ng doctors on how yung building ng trust towards us. Yun. So, we developed a questionnaire from the first study. I was actually part of the first study who conceptualized also this idea na we promoted a tool or created a tool that covers different domains. So we had a total of 4 domains. Yung first one is yung educational background of doctors on physical therapy, if meron ba silang, like if it's included in their pre-med or may exposure sila to trainings or seminars prior to referring. And then the other domains would be their experience mismo sa referral to PT. Another would be perceptions on the ability of PTs in treating patients. And the last domain would be our overall role as a PT in terms of treating also. So hopefully this would be a way to spark an inspiration para mas maging aware yung mga other professionals, not only doctors, but also other parts of the healthcare team to take initiative in knowing more about us.
What are the main findings that you've had, if you can share to us, like for our listeners, for the benefit of our listeners or viewers who haven't had a chance to read the article? LMA?
Yeah, I think
So,
Ella would best want to share that.
okay po. So kasi po, the word perception is a very broad term po, no? So it was measured po through the 4 domains that Miss Kyla mentioned earlier. So our study is a continuation study from Miss Kyla Carbonell's group. So in their research, they created this validated questionnaire named as Perception on Physical Therapist Questionnaire, or POPTQ. And then in our study, we tested it for its reliability. It's very important that we test a questionnaire for their validity and reliability, and then administered it to Filipino physicians practicing in the Philippines. So for our phase 1, so the reliability testing of the questionnaire, we administered it to 18 Filipino physicians, and in this phase, we ang results po namin is that the questionnaire is reliable, so we can use it for our phase 2. So for our phase 2, we administered it to 134 physicians, and the findings there po is that Filipino physicians have adequate foundational knowledge, they have positive perception, they have high awareness of PT's roles and scope of practice, but only 47.8% of those physicians reported of regular referrals to PT management.
To support that, Sir Johan, the results of the study actually turned well in terms of perception. However, they have physicians in the Philippines actually knows what are physical therapists. However, in terms of referral system, half of them says they don't usually refer their patients to us, and then half of them they feel the need to bring PTs into their team. Yun. So that's actually the interesting part of our study. So they know, physicians actually know the scope of our practice, but then it just ends there. Parang half of them says they don't usually refer patients to our practice, to physical therapists. Yeah.
That's quite interesting. The half of them don't refer, but I guess my question there is, why don't they refer? Is it because their practice don't have like patients that need physical therapists, or are they like intentional in not referring to physical therapists, or don't they know that some of their patients may benefit from physical therapy? Is it something that it would be explored in the future?
Yeah. Ella?
To clarify po, it's regular referrals.
Mhm.
So the the other 50%, they practice occasional or rarely, ganun po, and do not refer. Actually, it's one of our limitations that we didn't divide it by medical specialization. So we have physicians coming from medical specializations that do not generally or traditionally refer to PT. So yun
Uh,
po. Yun po yung
So yeah, it was that. Thank you for that, Ella. So that was the limitation because we really didn't identify specific specialization. But just to give you a brief overview, majority of the specializations we had in the study are orthopedic surgeon, general medicine,
orthopedics.
PMR, physical medicine rehabilitation, internal medicine, OB/GYN, and radiology, general surgery, pediatrics, pathology, family medicine, neurology, and then minimal number from pulmonology, oncology, something like that. And then majority of our responses were actually from orthopedic surgeon, from the orthopedic surgeons. Yeah,
Orthopedics.
no, Ella. Yun. Yun. So,
Yes.
to answer the sorry, go, Doc JJ. Go.
No, it's fine. Makamit, tapusin mo muna.
Ayun, so to answer the question, what was the possible reason why they don't refer? Actually, it was not asked in the questionnaire. I think it's a recommendation on the feature studies. What the study focused on is to get the general feel of the physicians with regards to the perception of the perception of the physicians in terms of our scope and practice. Yun lang. Hindi lang namin natanong sa questionnaire na yun. Yeah, Ella, do you want to add something? Okay.
Ano, sige.
Yeah, I wanted to add, no, I think both Ella and Ma'am Archelle are correct in saying or stating probably the reason for the results of the study in terms of its limitation. It is correct that it would have been better if the medical specialties were really chosen beforehand, because after hearing what Ma'am Archelle mentioned about the specialists, no, who were included in the study, there are specialists there who really do not actually see patients, like pathologists, radiologists. No, they see, like radiologists, they see the X-ray, MRI, CT scan plates. No, they interpret this, but there is minimal patient interaction. Much more for pathologists who just review slides coming from specimens of the patients. No, I mean specimens of parts of the patients. So for those two specialties, that is really not really a good pool of doctors to ask possible PT referrals. Even yung mga obstetricians, no? Even for obstetricians, no? Maybe they do sometimes, but they don't really do that, no? To refer to physical therapists. Although at least now your study included a population of doctors, majority in orthopedics, no? Who obviously really rely on physical therapists, whether it will be pre-operative or post-operative management of their patients, no? And of course, actually, kasi I'm biased. I'm a physical therapist too, so I definitely know the role of a physical therapist, and syempre, it's mostly what on yes, musculoskeletal orthopedic conditions. You have cardiopulmonary conditions, neurologic conditions, sports, no, and pediatric conditions. So I think it would be a good recommendation for this paper in future studies, no? If we would be choosing specifically, no, yung mga high volume referral on specialties that really require or are really known for referring to PTs.
So, Dr. JJ, you mentioned you're also a physical therapist and you're an orthopedic surgeon now. Does being a physical therapist, impact your perception on, of course, referring, or do you
Yes,
have like
it cannot be overstated, no. Syempre, it has impacted my profession as an orthopedic surgeon about all the referrals that I make to physical therapists, kahit nga occupational therapist, I also refer to them, or even sports science. No? So basically, it has provided me with a lot of foundational knowledge that I still use, no, until now, even as a orthopedic surgeon. Even if I don't really do the like the physical therapy management per se of my patients, but at least I'm quite familiar with mostly of the rehab protocols, no, for most of my patients. So I get to discuss it with them as well. Okay, actually, there are quite a few, but not very much. No, not very much. Not very many hospitals. No, that are able to directly refer to physical therapists. Now, because I'm not sure, since I graduated in 2001 from PT, I'm not sure if the system has changed already. But most of the time, I think what we are accustomed to is an initial referral to rehabilitation medicine, who is part of the rehab center, and then that rehab med doctor will be the one to refer to the physical therapist. No, but there are instances, I think, in sports, no, that the doctor, or probably the orthopedic surgeon, is the one that directly refers to the physical therapist for implementation of the PT program. And there are very few hospitals wherein you can also directly refer. No, like there are some private hospitals in Metro Manila wherein us orthopedic surgeons can just directly refer the patient to physical therapy and not to pass through rehabilitation medicine anymore.
Really, when I was practicing in the Philippines, I would receive some referrals directly from orthopedic surgeons, not just rehab doctors. Sometimes I also receive from family medicine doctors as well. I don't know if that's still happening right now. Tama ba?
I think it's still happening, no, but not really as common pa rin. No? The usual practice pa rin kasi dito is because I think, unlike the system in UK or UK countries, no, wherein physical therapists can directly see patients, no. But here, I think they still need to be referred, and of course, the referral mostly comes from the rehabilitation medicine doctors who man the rehabilitation centers.
Okay, so for the authors of the study, in your personal experience and opinions, how do physicians' perception of our scope as physical therapists impact our profession and our practice?
All right. So basing it from the results, actually I'm quite relieved on the results of the study, because when we first thought of the concept of this research, we were actually nervous about the turnout. Na baka, ano kayang perception ng mga doctors? Kasi pag dun pa lang, tawag nito, may maging negative yung result, baka there's something wrong with the system. But good thing, we are really happy that a lot of doctors recognize our efforts. And actually, if you will be checking on the results of each questions, there is really awareness, okay, of the physical therapy practice. In fact, they also attended some seminars and workshops wherein it was mentioned about the importance of physical therapists. But again, I would like to reiterate that the limitation of the study is because it covered a general population of the physician. Yun. So if we will be redoing this study, mas maganda siguro na specific population. So yun, sir, if I to base the result of the study, it's actually a positive thing for physical therapists, because doctors would really know the importance of physical therapists in terms of collaborating with the rehabilitation of our patients. And if we are asking about if we are talking about impact, this would definitely turn out to be good. Kasi it means if we will be revising our PT in the future, then the team who will be part of this interprofessional collaboration would have a general knowledge and idea, and of course specific about how to about the importance of rehabilitation and physical therapy. Yun. Yun po. So we are actually very happy about the results of the study. Yeah, Kyla and Ella.
To add lang po kay Ma'am Archelle, kasi since I was part of the first study who yung sa thesis proposal pa lang, doon pa lang po actually medyo nanganganib na kami kasi other than trying to find out yung perceptions no doctors, parang you're not sure if how they will take it, baka kasi
Yes.
ma-misunderstand.
Yeah.
Parang ang approach minsan appear as if we are overstepping, which is hindi naman yung intention namin. Yung intention namin talaga is to know if okay ba yung perception nila towards us para mas okay yung magiging referral system natin since we're heavily dependent on that. And yun nga po, since okay naman yung naging results of the study, although before we started this concept or this idea, syempre since dependent tayo on the referral system, parang nagkakaroon kasi, at least for me, I see it as, yung sabi ni Doc JJ na it goes through a lot yung doctors and then to rehab med. Parang nagkakaroon ng hierarchy or yung process tumatagal. And while we recognize naman yung and value the role of physicians in the decision-making process for the patient, sometimes yung practice natin as therapists, nalilimited dun sa nabibigay na prescription. And it comes into conflict kapag may mga treatment strategies tayong naiisip gawin na hindi natin magawa agad kasi we have to follow protocol, and then for us to implement that, kailangan we have to go back to them. And I think that's fine kasi communication naman, it's important in our field, in the healthcare field. Pero ang concern is magiging efficient ba siya for us if we go back and forth, and in terms of sa patient din, magiging cost effective ba siya sa patient na pabalik-balik sila, na instead of being able to resolve the matter at hand or being efficient in creating treatment strategies for the patient, somehow nagkakaroon ng gap or delay kasi we always have to go back to them before implementing something. Pero fortunately for the study, the results, okay naman yung perception nila or aware naman sila on our role. So hopefully it can aid in yun nga sa PT law po natin. Sure.
Yeah.
PJ, I saw you nodding. Do you wanna react? Yeah.
Actually, to add also to Ma'am Archelle's comment about having very good results, no. Actually, for me, I'm not really surprised because about the perception of doctors, regardless of whatever field, about the role of physical therapists. Kasi especially, no, well, for one, as med students, no, you have physical therapy medical students as well there, no? So of course, medyo nakikilala na rin yan. And then other than that, physical therapy is frequently mentioned, if not part of the subject that we teach in med school. Especially you have subjects in orthopedics, in rehabilitation medicine, even in cardiopulmonary medicine, neurology, pediatrics, no? So it's always really mentioned physical therapy. So I guess anyone who graduates from medical school really knows the role of a physical therapist. So I think that's really a known factor already. I would like also to actually agree, no, on the statement that somehow all these referral system makes it a little more tedious, no, for both the doctor and the patients, no. Like syempre, you are constrained as physical therapists to follow the prescriptions or the program prescriptions of the let's say the rehabilitation medicine doctors, no. But except for rehab med doctors, no, I think us non-rehab med doctors like me. I'm an orthopedic surgeon. Even if I even if I took physical therapy before, I'm really out of date already. Out of date na ako sa current trends in physical therapy management. And I'd like to think, of course, that physical therapists are more up to date, in terms of the management, because I'm sure nag-iba na ang landscape of PT management since 2001. Of course, we know the basics now, but there are new techniques and new treatment strategies that are now popular and available already. So for me, I have no issues with direct referrals to physical therapist, because actually I trust my physical therapist, to be able to manage the patient properly, because at least they are more up to date with current trends compared to me.
Mhm.
Thank you, Doc JJ. And we mentioned, you mentioned, Doc JJ, that physical therapy is heavily mentioned in med school.
Hindi lang siya, hindi lang sa in passing, no? So it's really
Yes.
best. That's syempre, hindi naman kayang gawin lahat ng doktor yan. So may sasabihin niya palagi sa lecture, after, what are the treatment options? This, physical therapy. And then, ganun, no? So every time palagi, no? So it's always mentioned, discussed as part of the entire treatment plan for the patient, from medications, to conservative options, to surgical options, even for, of course, for physical therapy.
So actually po, maybe Doc JJ can confirm po of this finding, kasi one of our findings po was one of the reason why yun nga po sa referral, we found out that it's because there was a lack of collaborations between PTs and physicians during their academic years, nung nasa med school pa lang po sila, and exposure only happens during their residency. So Doc, do you pa-confirm po if there is just limited or no opportunities at all among medical students to
There's
shadow
not
po?
no opportunity, but maybe because it is only like one or two subjects, or maybe in the other subjects, but it's part of the entire subject lang, no? So it is mentioned as an option, but it's not further discussed anymore. So yes, maybe a medical student who isn't let's say a medical student has a pre-medical background of biology, Siyempre, after med school graduation, ang alam lang niya is I can refer for physical therapy management for cases of stroke, for cases of cerebral palsy, for cases of hip replacement and something like that, But hanggang dun lang. Of course, it is no longer the medical students are no longer taught about the core subjects of what we were taught in physical therapy. Wala namang kinesiology in med school, Wala mga ganyan. It's mentioned in passing. It's part of the anatomy subject, but it's not really focused. Okay, even for the, let's say, part of the physical examination, for musculoskeletal examination, range of motion, MMTs, yes, they are taught, but they are not really taught in very much detail that it will take one whole subject for one whole semester to teach MMT and range of motion. Diba? Dati ganun dati pag PT. So med school part lang yan, baka one day lang yan. one lecture session lang yan. So they have a general idea, but not maybe the specifics about it. Okay. And the exposure really, not really in residency, but most likely in the last year, clerkship, Pag may rotations na kasi yan sa actual, pag clerkship, may rotations na sa rehabilitation medicine, and then for internship and residency as well, So yung first 3 years talaga, ano lang talaga siya, It's mentioned, and but not really explained deeply.
How about, Doc, yung parang shadowing a PT in practice po among medical students and rotating po dun sa mismong PT rehab department?
Okay. So yun, I think shadowing is not really done. That's not done. What happens is more of the clerk, medical clerk, no, the fourth year medical student who will rotate in rehab medicine will mostly shadow the rehab med doctor.
Yes.
No, but in terms of the implementation of the PT programs, no, by the therapists themselves, hindi mo naman makikita sa bedside yung medical clerk dyan para manood kung ano yung ginagawa, no? Kasi I think that's also maybe what some kind of delineation, no, of work, no, in terms of like the physical therapist will handle the physical therapy of the patient, no, parang ganyan. But it will be interesting, of course, no, if rehab medicine as a subject, I think if there was any other field that was in position to incorporate any sort of collaboration between physical therapy and the medical profession, it's rehab med. Because sila ang nandoon, no? They are there with you every day, no? So I think that's also a good idea, no? To initiate some collaboration, to raise more awareness. Although yung basic awareness is there, no? But maybe to really heighten, no, everyone's knowledge about the exact and specific roles, that will be a good plan.
Yeah. Actually, that was a good question from Ella, because when I was revisiting the results about collaborating of PT graduate, of physician and PT graduate during residency, half were actually collaborating, but then the other half, no exposure on collaboration during residency training. Maybe because of the specialization na po.
Yes, correct, ma'am.
Yeah.
Kasi syempre, why would let's say a pathologist collaborate with a physical therapist? These are two worlds apart kasi, no? Maybe collaboration could be specialty specific, no?
Yeah.
Collaboration with rehab med or those fields that have physical therapy, patients that are for physical therapy, no? Yung nga, pedia, cardiopulmo, ortho, neuro, no? That's it.
Yeah.
And you mentioned in your research, ma'am, that in your recommendation as well, you mentioned that to increase collaboration opportunities between physical therapists, students, and physician in their academic year. I think you're pertaining to interprofessional education, right?
Yes.
So what do you guys suggest in trying to achieve this type of opportunities for both med students and physical therapy students, or do you see any barriers in implementing this?
Well, of course, I've been practicing as physical therapist for quite so long, and I would agree with Doc JJ. Referral to physical therapists is very limited, and it would be much more on those specialization who really needs physical therapy. But then there are actually other specializations, especially in the US, that recognize the importance of physical therapy. Like for example, OB-GYN. There's pre-pregnancy exercises na, no? Na I think you can also agree with that, Sir Johan. Meron na sa US na ganyan. Anyway, to talk about barriers, I think especially in internship, maybe we can expand the exposure of physical therapy students as well, collaborating with maybe interns, physician interns from different fields. That would include maybe OB-GYN, ano pa ba?
Actually, ma'am, ano po, dermatology po kasi we also handle burns and wounds po na Philippines. Also po, plastic surgery. Yun po.
Yeah, actually, mga ganyan, plastic surgery or general surgery, pwede rin yan, especially for burns, because for plastics, no, they handle burns as well.
Mm-hmm.
But you have to think about what kind of collaboration is this, like a interlevel conference? Is it a research collaboration? Mga ganyan.
To add lang po, siyempre ako as a recent board passer, yung experience ko lang so far is during internship. And over internship naman, I was given the opportunity to practice in different settings na we were able to interact or collaborate with other professions, not only yung mga OTs, SLPs, even yung SPED teachers. I was also given an opportunity for that. And in one center na very independent yung intern practice, we were also able to communicate and address issues with doctors or yung resident doctor. So parang from there, comparing those, from my experience, comparing those experiences na I was able to collaborate with doctors as compared dun sa may mga who follow strict protocol lang talaga. In terms of patient outcome, mas okay dun sa mga maraming minds ang nag-work in one case compared sa parang we just follow what is given to us. So ayun, important siguro during internship pa lang ma-establish na yung interprofessional collaboration among different professions para maki-carry over siya even after we take the boards. Ayan po.
I remember nung internship ko in Sapang Palay before. Ewan ko kung mayroon pa nun. Parang wala
Wala na sa Pampalay.
Wala na sa Pampalay.
Wala po.
So, independent kaming mga PT interns doon, then the clerks are there. So really, kami lang talaga bahala dun sa mga patients na dumadating. So ang parang ang ganda ng communications namin doon. They would ask us, is this something that you can help out with? So parang doon ko na feel na we're really working together.
So, ano ang batch mo, Johan?
2009.
2009? Yeah, meron pa nga.
Baka kami na yung mga last batch.
Kailan ba siya natanggal? 2013 or 14, something like that.
Mm-hmm. I mean, that's a good example ng, exposure ng
ano po,
and PT.
yung hopefully, parang it's a great experience for me, but sana na-experience din siya ng ibang interns following me or the next few batches. Kasi yung I came from before that rotation na I was independent. That was in PGH actually. Before that, yung mga centers parang yun, we follow a strict protocol. Tapos nung pagsabak ko sa PGH, parang on the first day, like, ano bahala dyan. So, medyo na-culture shock ako na anong gagawin ko. Pero, kasi ang prescription ng doctors, parang general rule lang or it's just a general flow. So, nung first day, mangangapa-ngapa pa. Pero with the help of the feedback naman from my supervisors na who guided me on what to do or what's a better approach, ayun, mas nagiging okay yung outcome pag tayo mismo nag-create ng plan. At the same time, we collaborate with the doctors para parang yung residents, tayo mismo tatanungin if kamusta yung pasyente or like what can we add or, exchange of thoughts. There's a balanced exchange of ideas then from both parties.
I think, for realistically speaking, of course, it is not really observed, but it's really also quite a known fact that physical therapists or even residents, and even interns, medical interns, have more leeway talaga in government hospitals. More leeway in a sense that they can be a little more independent and not just follow the dictates of the consultant. I think the only reason or one of the major reason why this is far different from private hospitals is because of the private nature of the patients themselves. Of course, it will be very hard to explain to the patient, a private patient, that we will leave or give the controls over to someone other than us. Of course, syempre mas gusto nila na talagang very supervised. And I think that's the reason why in private settings, it's very much stringent compared to in government practice.
This is a nice discussion. coming from the research, finding out the perceptions of physicians on what what physical therapists do. And thank you, Doc JJ, for giving us the perspective of physicians, and the results of the the study is good, na very optimistic, na they know, the physicians know what we do. So I guess it's a matter of really um channeling down on really who refers to who, and raising awareness to those who don't know much about what physical therapists do. So probably my last question before we end this discussion, um, on the physical therapist side, how can we as individuals or as a profession raise awareness on our roles and scope, uh, to the physicians, and or what can we do better as a profession?
Oh, sige, ako na lang. All right, I think from a physical therapist perspective, our profession is really young pa to start with. And then there are a lot of things to discuss. And then aside from physicians, okay, some physicians, the masses also needs to be educated about physical therapists. But good thing, no, kahit ngayon, I think nag-improve yung perception naman ng public about our profession. Well, I think one of the main thing, no, that we can do to raise awareness is to be vocal on it. We'll provide many education about the scope of our practice. Maybe we can do a lot of groundwork to really show the people, the, our partners in terms of rehabilitation, of what physical therapists can do. Now, of course, another thing is that I think the officers from PPTA would agree, no, there's a need to really revise the law. So medyo matagal na. Pero I think it's been undergoing processes in terms of how on revisions. But then there's really a need to upgrade our current practice here in the Philippines. And of course, if we're gonna upgrade our practice here, so of course, physical therapy should also step up, diba? So we don't settle on traditional therapy. So kailangan nating mag-grow din as a professional. Yun. Tapos another thing is that when I was looking at the results of the study, there were three major questions kasi in terms of referral and physical therapy. One is they do not refer, strongly agree, and then agree. So tatlo lang. And then when I was reviewing the results, majority of the physicians answered the agree criterion, hindi yung strongly agree. So ibig sabihin, parang meron pang somewhat may neutrality pa, or merong apprehensions pa on referring their patients to physical therapy. But again, this is this is talking about a general perspective of physicians that were included in the study. But basing it on the result, marami yung nasa level ng agree but not on the strongly agree. Parang ganon. Di ba, Ella?
Yes.
Yeah. So siguro sa physical therapist, kailangan pa naming dagdagan yung effort namin to really be vocal on what physical therapists can do on a general specific conditions that requires rehabilitation. Yun po. Thank you.
Anything to add, Ella or Kayla?
I actually agree din po kay Doc kanina na kapag kunwari po sa residency, it may delineate po yung kapag for example, shadowing. So maybe it's dapat po physical therapy promotion specific to that medical specialty yung promotion na pwede nating magawa kung during the residency na. So maybe for example, anesthesiologists, roles of PTs in terms of pain management, yung mga ganun po. So bale parang i-individualize din sa bawat medical specialties. Maybe we can do that. Siyempre po, physical therapy naman po has come a long way and it's constantly evolving. So maybe in the future po.
To add lang din, primarily naman yung objective talaga ever since nag-conceptualize on this study is yun nga, to promote a more efficient and dynamic referral system in the country. So technically, it still revolves around the concept of having a referral system. But hopefully, yung study na to, it sparks an inspiration for us to eventually promote PT as a profession that is capable of being direct care providers like in other countries. Hence, sabi ni Ma'am Archelle, yung update nga yung law natin. And raising awareness on our roles in the healthcare team, of course, it opens opportunities for better collaboration with different professionals. However, I don't think it will entirely address the important concern na if hindi tayo na-recognize as someone na pwedeng malapitan ng patient in a direct manner or a primary care provider, or even just the potential of developing into one, it can only our raising awareness can only do us so much. And yun, as said by Ma'am Arshel earlier, hopefully in the future as a profession, we grow together to push forward and towards the opportunity of becoming director providers. And for the meantime, habang andun pa yung law na nalilimit tayo for most part, I think as an incoming clinician, dun papasok yung being more proactive at work, finding the middle ground between following protocol and being also an active participant in the treatment provision, especially if hindi na nagmamatch or may mismatch dun sa patient goal, sa therapist goal, and sa prescription na binigay. Of course, we understand na there are also protocols being followed by physicians in terms of the prescription, but I guess dun ma-highlight yung importance of having quality communication among the team. And one of the ways to describe a great quality of communication is if may balanced exchange of information between both parties. So by being aware of perceptions of physicians and them being receptive as well to us in the decision-making process, we can identify both strong and weak points, eventually be able to do something about it, and mag-translate siya hopefully in terms of patient outcomes, better patient outcomes. Kasi yun naman yung goal natin lahat in the healthcare.
And Doc JJ, having been in both worlds, physical therapist and physician, how do you think the profession of physical therapy should raise awareness in what physical therapists do in the eyes of physicians?
I guess they've all mentioned it already. No? Number one talaga, I think it's a very important thing is to amend the law to give the physical therapist more independence. That is a very old law, even older than me. So I think it's about time to amend. No? Number two is Ella is also right. No, specialty-specific collaborations could be the key because at least if you let's say collaborate with pedia, no, for your CP patients. If you collaborate, let's say with Neuro for stroke patients, so it will increase more awareness within the that specific specialty. No, so right now, like for us, no, for orthopedics, even for our national or annual conventions that we always have together with other orthopedic surgeon speakers. We also always have physical therapists, rehab med, meron pang sports science, no. So we always want to collaborate with them, no, to get a more holistic picture, of how the treatment plan or treatment strategy should go. So I guess more, I think of course we cannot expect some more collaborations in the undergraduate years because syempre everyone's busy in their own, doing their own thing, no? But I guess after everyone has already received the proper foundational knowledge, then during internship maybe, then I think that's a good place for collaborations to start, no? Even as simple as mga case conferences, no?
Yeah.
And then after that, no, I think also maybe it's a good thing if the physical therapists in not just from the school, but from different hospitals or from different rehab centers, no, will be really more proactive in promoting physical therapy, no, the role of physical therapists, especially during mga World PT Day, yung mga ganyan celebration, no, to enhance more awareness among everyone.
Right. Great answers. So again, thank you everyone, Archelle, Ella, Doc JJ, and Kayla for joining us and having this discussion about the your article, your research, and also some other points that this research has like opened up. I hope the discussion continues with other colleagues, and the interest in providing care among and collaboration among healthcare professionals continue. So thank you for coming over and joining us in the podcast. And for those who are interested in reading the article, you can go to soar.usa.edu/phjpt or soar.usa.edu/phjpt and you can look at download their articles there. So thank you again, everyone, for being in the podcast.
Thank you.
Thank you everyone.